All right, good morning. Thanks for joining me. So, today we're going to talk about hearing loss and COVID-19 and tinnitus. My name is Dr. Meg Cates. I'm the owner and audiologist at Hearing Solutions. So, let's jump in. Okay, so today we're going to keep it very pragmatic, just talk about what it is that you need to know about COVID-19 and hearing loss with tinnitus. Like I said, I'm Dr. Meg Cates. I'm the owner of Hearing Solutions down in Louisville, Colorado, in historic downtown. A little bit about me. I'm originally from Arkansas. I moved into Colorado with my husband in 2015. We've got some family in the state, and it's been a great place for us to work. So today, what are we going to go over? We're going to go over a little bit of an introduction about COVID-19 and hearing loss. We're going to talk about the hearing loss and tinnitus implications of COVID-19, the communication impact, and the impact of audiology services in general. All right, let's go. So what is COVID-19 anyway? Well, it's a little bit complicated. The reason that it's complicated is the transmission. When the pandemic first started, we were all seriously, quickly wiping down surfaces as much as we possibly could. The transmission method of COVID-19 is that droplets will travel from one person's mouth to another. What could also happen is that it will transmit from one person's mouth to the other person's T-zone. I'll show you that in just a minute. The impact of it, however, is less like a respiratory disease. Epidemiologists are actually saying it's acting more like a bloodborne disease. All right, so T-zone. What I mean by T-zone is that you can get the transmission of those droplets, your eyeballs, your nose, and your mouth, not your T-zone like in between your eyes up to your forehead. Okay, so in terms of a bloodborne disease, here's what we're talking about. It's transmitted over droplets, but it's actually causing internal organ damage. And that can range from the widely known impact on lungs, because you may have heard of COVID lung, but it also can extend to the rest of the body. There appears to be scarring that can happen with the organs on the, with our internal organs, and it can have wide-reaching impacts. So let's talk about what that has to do with hearing. As you can see here, here's just a picture of the inner ear. What we're looking at is, here we have the organ called the cochlea, which allows us to sense our hearing and send that to the brain. And then this part of the ear that is actually responsible for our balance. If you can take a look here in red, you can see that there's actually a blood supply that goes to both the cochlea and to the vestibular part of our ear. What I would like to point out is there's really only one main artery that supplies the blood to the ear. And as it happens, any kind of systemic issue with your body, whether it's diabetes, whether it's multiple sclerosis, any number of autoimmune issues, anything that has a chance of impacting the blood supply to the ear has a chance of harming hearing or creating tinnitus. So the reason I'm having this talk today is that there's actually early reports that are pretty alarming when it comes to hearing and tinnitus with COVID-19. Early studies are showing anywhere from 13% to 40% of reports from people who have had COVID-19 who are saying that they're having a new hearing loss, a new amount of ringing in the ears, or that it's worse than when they previously started. If you're interested in looking at the specific studies that are being done, these are the folks that I know of that are continuing to do that research. Dr. Matthew Stewart, Dr. Bukes and Dr. Kevin Munro over in the UK. Another reason to pay attention to COVID-19 in regards to hearing and tinnitus is that some of the medications that were used early on in the pandemic to try out to see if it would be effective in treating COVID-19 are actually toxic to your hearing. The hydroxychloroquine and chloroquine, we don't quite know how often it occurs, but we do know for sure that there is a possible level of hearing loss, deafness, tinnitus that can happen just from taking the medications. Now, the more recently used medication, the remdesivir, the maker is telling us that there's no known origin or cause of hearing loss associated with it. But if you know somebody that took hydroxychloroquine or chloroquine to have treatment for COVID-19 and towards the beginning, then you may want to check out your hearing. Turns out it can have an impact on it. There generally are health issues that affect both COVID-19 and hearing loss. And what I've done here is highlighted from this list the different conditions that I know of that can have a side effect of hearing loss along with COVID-19 or along with these particular disorders. So as you can see, cancers, chronic kidney diseases, heart conditions, smoking, type 2 diabetes, all of these things can actually increase your risk when you catch COVID-19 or if you do for having more serious complications. They also happen to be associated, the ones that are highlighted, with an increased risk of hearing loss. So now I'll talk a little bit about the communication impacts of being in a pandemic world. You can see here's a picture of my dog. This is Bernie. And so the question for you to consider, if you're trying to communicate clearly during the pandemic while we're all wearing masks, the question is for you to consider, what kind of mask actually muffles speech the most? You may be aware that there's different kinds of masks out there. You can see a simple cloth mask here in A with the ear loops. You can see a non-medical mask that you tie on in B. And then there's also these clear view masks that are floating around. I've seen some that are homemade. There's essentially a vinyl panel that has a visual window so you can see someone's lips when they're talking. What that ends up doing is allowing the other person to use speech cues and basically read lips so they can understand. So out of these three options, consider what you think would mask or muffle speech the most. The answer is C. So here we have the clear view mask with the window. Hey, Nico, go ahead and pause the recording. A friend of mine's trying to get in.
This conference will now be recorded.
Okay. So I'm going to mute everybody. Here we go. Good morning. My name is Dr. Meg Cates. I'm the audiologist and owner of Hearing Solutions in downtown historic Louisville. This morning, I'm happy to share with you some information that I have found on COVID-19 and how it impacts in relationship to hearing and tinnitus. So here we are. We're going to share my screen and walk you through it. All right. A little bit about me. I'm originally from Arkansas and have lived in Colorado for the past 5 years. I took over Hearing Solutions in 2018 from Buddy and Chris Jewell. They had actually opened this practice back in 2004. So today, here's what we're going to talk about. I'm going to give a little bit of an overview about COVID-19 and the relevant parts of how it works. Then I'm going to go into the hearing loss implications of COVID-19, including tinnitus. Then we're going to talk about the communication impact and then the impact on audiology services that you need to know. All right, here we go. What is COVID-19 anyway? Well, as you may have heard, it is the transmission avenue that is used. It is being transmitted from droplets. So droplets mean all of the air coming out of your mouth, and how it's traveling is from one person's mouth to another person's T-zone. And by that, I mean your eyes, your nose, and your mouth. But the impact of COVID-19 is quite different than a respiratory impact. Epidemiologists are now saying that it's acting more like a bloodborne disease. Well, what does that mean? What that actually means is that while COVID-19 is being transmitted over when we're talking, when we cough, when we sneeze, when it's received, the viral load is actually attacking our internal organs. You may have heard of post-COVID lung. That is one example of many of different organs affected by the damage of that viral load. So we are getting scarring in different places, and we have a lot of things we just don't understand, but somehow it's actually being transmitted through the entire body once you have it in your system. So what does that have to do with hearing? This is a picture of the inner ear. And what I want to highlight for you is that in red there is a blood supply. There is only one blood supply to the ear. You can see that it branches out towards the bottom. You may see the cochlea, which is the sensory organ for hearing. And to the left, you can see that it actually provides a blood supply to the vestibular system, which is part of the system responsible for balance. The reason I'm showing you this is that if that particular blood supply happens to get compromised from anything, including COVID-19, it can have an impact on these organs. There are early studies showing that in fact people are reporting incidences of new or worsened hearing loss or new and worsened tinnitus ringing in the ears of some kind, ranging anywhere from 13% to 40%. There are 3 different labs that I know of that are starting to do this research. They're listed there. Another consideration is the medications that have been used in treatment. Early on, there were some use of hydroxychloroquine and chloroquine. What we already know about those particular drugs is that they can have a side effect, rare but serious, of deafening your ears. Later on, with the use of remdesivir, so far we don't know of any particular impacts on the ear. So if you or anybody you know has taken hydroxychloroquine or chloroquine, whether it was for COVID-19 or for anything else, some arthritis cases use it, there's other uses for those particular medications, it's a good idea for them to monitor their hearing. What I found really interesting when I was looking into the information for this presentation is how many risk factors that overlap between COVID-19 and hearing loss. As it turns out, here is the list from the CDC that I found that shows a known increased risk and a possible increased risk in terms of the impact of COVID-19. We all know that everybody has a different experience with it. But if you happen to have cancer, chronic kidney disease, obesity, pregnancy, smoking, type 2 diabetes, those things are going to put you at a higher risk for the impact of COVID-19 being worse. Highlighted here are what I know to be comorbidities or an increased risk factor for hearing. Type 1 diabetes, type 2 diabetes both have a 200% increased risk for hearing loss compared to those without diabetes. It's interesting to me that there's so much overlap. All of this is really to point out that anything that is systemic in your body appears to put you at a higher risk for hearing loss and tinnitus, and also a higher risk for the impact should you catch COVID-19. Now we're going to move on to the communication impacts of the pandemic, particularly with the masks. Pictured here is my dog Bernie. And what I want you to think about is when you put on a mask, you're taking away visual cues for communication. And there are different kinds of masks that have come out. There are the KN95 masks. There are the N95 masks. There are the surgical masks. Here I have pictured cloth masks and then one of the clear view masks. What those clear view masks have in common is they have a piece of clear window right in front of the mouth. The purpose of those masks is so that if you're communicating with someone who relies on seeing you and reading your lips for communication, then it's necessary for them to see your mouth. As you think about this, what do you think in terms of cloth masks, clear view masks, KN95 masks? What is going to muffle speech the most? As it turns out, that piece of clear vinyl in front of your mouth is quite muffling. There have been a few acoustic studies to measure how well you can hear the speech signal. The reason I'm bringing this up is not all masks are the same for everyone. In my clinic, typically I'll wear a surgical mask as required by my county Department of Health. But there are times where I need a clear view mask for my patients who they would rather see my face and my voice be a little bit more muffled so that they can speech read or read my lips. So it's hard. Right now, anybody with hearing loss, anybody without hearing loss who relies on looking at someone's face to understand more robust, it's a hard time. A lot of my patients here at Hearing Solutions have told me when they go out and about, not only are we all trying to be careful on the amount of time that we communicate for our safety, but also all of those cues have gone away and it's muffled. So what is that person supposed to do? Even with hearing aids pick up best within 6 feet. As you think about it, think about how we are distancing at least 6 feet from one another when we don't live in the same household. So those even with hearing aids for their hearing loss are having a hard time. One solution is to look at a bunch of different apps. Thankfully, a couple of months into the pandemic, one of my patients who is one of those that relies heavily on speech cues, and she would be a perfect candidate for me to wear one of those clear masks, brought to my attention this app. Live Transcribe from Android is actually a collaboration between the Deaf University, Gallaudet University, and Google. It is a free app that you can install on any Android device and will provide live captions just like the closed captions on your TV. If you have an Apple device, Live Transcribe is a separate company, believe it or not, with the same name. They will charge you $5 a month, and that is available for Apple devices. Live Transcribe that I showed you a moment ago is Android only. So if you want the same thing, you can get it pretty much. They're two different companies, but I've tested both apps. They're both good. This is an option for Apple. If you're looking for a free option, that would be Ava Captions. So all this just to say that there are apps out there that are helping to live close captions. So as you can see with this phone, In your pocket on your smartphone, you can have a closed captioning machine. How my patients are using it is when they go to the bank or they go to the grocery store or wherever and they need to communicate, they bring that app up and it allows them a backup method of understanding just in case the person they're talking to is so muffled for them that they can't understand quite. This has been a great thing to show my patients. I've had multiple people download these apps and I've gotten great feedback from them. Even if you don't have hearing loss, it's kind of nice to have because you can make sure you know what someone's saying if you don't understand them quite. There's other apps too. If you are someone who has hearing aids, then there is likely a mask mode built into your hearing aid app. So if you have a relatively new version of Signia hearing aids, Starkey hearing aids, Resound hearing aids, those three companies I know have a mask mode built into the app. So what that means is that you can open your hearing aid app, put on the mask mode, and it will amplify more those pitches affected specifically by masks through their research. If you don't have one of these modes, if you don't have a newer pair of hearing aids, talk to your audiologist. There are many ways in which we can help you with your hearing aid settings so that you can make it through this challenging communication time. Now I'd like to talk a bit about audiology services and how the pandemic has affected that. So with the advent of COVID-19, I have seen so far 1 to 2 persons who've come to me thinking that they have gotten hearing loss after they contracted COVID-19. So it's important audiology services are considered an essential service. So this whole pandemic, we have been helping people with their hearing aids, and ever since May with our COVID-19 disinfectant protocol, we've been seeing people for hearing tests too. So with audiology services, you can expect a wide range of options. You can still see audiologists in person. Of course, we're going to require mask usage. Many offices, including ours, have added curbside services. So if you happen to have any of those risk factors from earlier in the presentation, that would be a good time to consider either drop-off services, telehealth visits, and just giving us a call when you need help and we'll figure it out with you. I have had a few patients who were comfortable in their car and I would mask up and glove up and I'd go out there and get their equipment, bring it into the clinic, take care of their equipment and bring it back to them. And that was their level of comfort. So what we're trying to do in this field is basically meet you where you're comfortable. Not everybody's going to be comfortable with curbside, so we've had some drop-off services. On a regular basis here at Hearing Solutions, we see people who are in their 80s and 90s. So expanding the services so that we can do webcam visits for telehealth has been very important. We certainly can do phone screenings also for new patients, just to get an idea of what they're coming in for, so that once they're here, we can actually cut down on the amount of time they're here. Now this chart is really the information that we have for COVID-19 and audiology services on the amount of risk that you're bringing to yourself. So let's say that you're coming in to have your hearing tested. The highest risk spot in an audiology clinic is inside the sound booth. As you may know, sound booths are calibrated annually, they're nice and quiet, but that also means they're not very well ventilated. So it's very important to minimize the amount of time that you're in any kind of sound booth. What we're doing here at Hearing Solutions is we put a large air purifier to help with ventilation, and in between anybody being in the booth, we set that on high so that we can mix the air. Studies are showing that ventilation is possibly the biggest key for keeping down the spread. In terms of talking to the audiologist or hearing healthcare professional and just consulting with them and working on hearing aid repairs, that's pretty low risk. We do disinfect between every appointment. Surface decontamination is a part of our regular practice. That part is actually quite easy to control. So I urge you, if you need a hearing test, make sure that where you go has proper ventilation, because if you think about a booth that's made to be quiet, it's not going to naturally have ventilation. You have to create it or use some sort of air vent. Now here in Boulder County, these are the rules that we're following. So we are taking people's temperatures when they come in. That's pretty old hat for everybody by now. You may have a questionnaire. I have heard of several audiologists during this time having to reschedule appointments because patients come in after going out of state. So just keep in mind that if you're traveling, it's going to be a good idea to give a couple of weeks time before having an appointment with any hearing healthcare provider. We here at Hearing Solutions are actually locking our doors and letting people in one at a time. We are not allowed to do walk-in appointments. That's not allowed by the state, or excuse me, the county. So these are the things that are going to be required. In terms of where we go from here when it comes to this hearing and tinnitus piece, like how are we actually going to serve people? Well, there are some virtual hearing tests going around. From my research, they're not as accurate because they're not annually calibrated equipment, but they could serve as a screening tool. As we are talking right now, there has been funds released in the UK for Dr. Monroe's lab to study, actually, is it 13%, 40%? How many people are really getting hearing loss and tinnitus? The COVID vaccine that we are now starting to roll out in this county, there are RNA vaccines that have been developed worldwide. And as of last week, in case you didn't hear, Governor Polis released the vaccine to all of those individuals 70 years of age and up. If you want to know about getting your vaccine, contact your primary care office or your Department of Health in your county. So, what I'd like you to take away from this presentation is a few things. I would like for you to test a transcription app. You never know if it could come in handy for yourself or a loved one that's with you, particularly, if you're social distance visiting family outside a senior center. It might be nice to have an iPad or a tablet with a transcription so that with the text turned up so that your loved one can understand you when you speak. The other thing is to create an emergency plan for if you need to go to the hospital. And the reason I bring this up is that we are having a hard time with patients being able to understand at hospitals. So if an emergency should occur, it's important for you to have on your medical alert card and your wallet if you have hearing loss. Because if you have hearing loss and you don't have your hearing aids with you, the healthcare professionals might misunderstand and think that you are cognitively confused, or they may not know to provide you your hearing aids and make sure you have them during your hospital stay so you can understand your care. So if you take anything away from this for having hearing loss or having tinnitus, but if you happen to wear hearing aids or have an untreated hearing loss even, make sure you have an emergency alert card in your wallet and put on there that you have a hard time hearing. It's just important for you to get the same level of care as other people who don't have a hearing loss. Lastly, get a baseline hearing test. If you yourself or if you know somebody who's experiencing hearing loss or ringing in the ears of any kind, that's the time to get a baseline hearing test. What I'm seeing from the individuals I've been testing during the pandemic is that some folks are recognizing a hearing loss that they didn't recognize before because people are wearing masks. They didn't realize they were relying on that speech cue. I really appreciate your time this morning. So if you'd like to contact us, again, my name's Dr. Meg Cates. We're down at Hearing Solutions on 724 Front Street and located in historic downtown Louisville. If you'd like to make an appointment with us, you can call us at 303-666-8149. You can make an appointment online on myhearingsolution.com. So thank you again for your time this morning. And if you have any questions whatsoever, please give us a call, reach out. I'm happy to answer them. All right, thank you so much.